This is an oxygen tank. We know this because the cylinder is usually white with a black cap. When using this, we would lie it down for safety purposes, and if the regulator is on, it may break. Before attaching the regulator, we check the Botox seal is not perished so that it will seal properly. When we attach the regulator, we line the prongs up and screw it on. We make sure the dial is on 0 before turning it on, and check the gauge to make sure there is oxygen in the tank. To check sufficient airflow, we turn the dial. There is sufficient airflow. We turn it back off. We will attach a simple mask to the regulator. The flow rate of a simple mask is usually 6 to 10 liters per minute. When finished, we'll turn it back off. Turn the regulator off and bleed the remaining oxygen out. Before we use our suction kit, we must make sure that all the tubing is intact and on properly. We need to turn it on, check the battery capacity. We also need to check the suction kit and test it. So we block off the tube, wait for the lights to light up, and then hold down on the test button. Once that lights up, you can let go, turn it off. We then need to check the tubing, make sure it's not damaged. Check the rigid catheter, make sure there's no cracks in it. We can then turn it on and check the suction by blocking off the hole on the rigid catheter. We can hear that there's suction. Turn it off. Before using it on a patient, we must make sure that the patient is on the lateral side and stable. So don't use the suction kit on a patient that's having a seizure. We must never use it also in a moving ambulance. When using it on a patient, we must only go in as far as we can see and suction only on the way out in a circular motion for 10 seconds at a time. Complications of using a suction kit can be stimulating the vagal nerve, which causes bradycardia, induced vomiting, which then can cause aspiration, laryngospasms, soft tissue damage, and hypoxia. We're going to check our ECG monitor. This one that we're using is LifePak 12. We'll start at the back here and check the batteries. Press the button so you can see that one's full. Check this one, and this one is running low. So before every shift, we usually swap them out and change it. So in this pocket here, we have our adult and pediatric BP cuffs, our defib pads, our dots, and extra printing paper. In the pocket just on this side, this is our defib pocket. We have our defib cord, our test load, which we will hook up. We also have our razor, GTN spray, and aspirin. We must make sure to check expiry dates on those. So now we will turn the monitor on and press code summary. As it's printing, we'll just check this pocket just here. So we have our SpO2 cord, our ECG cord with our 4 lead on it. Also in this pocket we have our 12 lead, which we will hook up to our 4 lead. Just in the pocket here. Here's our 12 lead. Also on this side we have our BP cord. So now we will charge a shock. We'll change it to manual mode. So it's charging to 360 joules. it charges, we will press the shock button. So now we will disarm a charge, so we press the charge button, charges to 360, however we will push the middle button to disarm the charge. Also we will check the lead, so we press the lead button. So here we can select whether we want to use 12 lead, 4 lead, and then we will check the size of the ECG. So we can check max is 4.0 and the least is 0.25. Then we will press the option buttons. Here, as you can see, you can add patient's name, date and time, do alarm volume, and then push home screen. So then we'll push the middle button and go to our top right corner in our heart rate section. Push the middle button. Here we can select the volume of the QRS, whether we want it high or low. Then we will push the home button again and pull off our code summary. From our code summary we can see that this machine is running fine. Here we're just going to check our first response kit. In our top pocket we have adult and pediatric BP cuffs. We have shears, stethoscope, pupil torch, thermometer with extra caps, also our BGL kit. In our BGL kit we need to make sure that there's extra band-aids and alcohol strips as well as test strips for the BGL kit. In the pocket below, which is usually our PPE or miscellaneous pocket, we can find things like our biohazard bag and our protective goggles can sometimes be in there. On the side here we have our trauma pocket, and here we can find our tourniquet, saline solution, tape, wound dressings, gauze strips, steri strips, also our crepe and triangular bandages. On the other side at the top we have our emesis bag, spinal lanyard, and our epichloride spray. In the pocket just below, which is our glucose pocket, we can find our glucagon, syringe, oral glucose and IV glucose, and also our IV administrator. On the inside, at the top here, we have our methoxyfluoride. We also have our pain relief. We must make sure to check for expiry dates on them, which is usually our Panadol, Tramadol, ibuprofen. In the pocket just below, we have different size OPAs and NPAs, different sizes for pediatric and adults. We also have forceps and our laryngoscope kit, which is pediatric and adult. In the pocket just below, we have our adrenaline and asthma medication. You need to check expiry dates on them. We also have our nebulizers, our nebulizing mask, our nebulizer and nasal prongs. In the base of our first response kit, we have our slippery sands, our shots container, IV fluid, towel, different size splints, neck brace. We also have our IV bag, our LMA, and we have our BVM kit. In our BVM, we have our bag valve, different size masks, oxygen tubing, PEEP valve, reservoir bag. So we have been dispatched out to a possible cardiac arrest. Checking for dangers. There's no dangers around. Bystanders have been barricaded. Patient is on stable ground. We are wearing our PPE gear. So we will enter the scene. Hello sir, can you hear me? Sir, this is Maria. I'm Maria and this is Louisa from the ambulance. Can you hear me? Hello sir. Patient is not responding to any local commands. I am about to inflict pain onto the patient. Hello sir, can you hear me? Patient's not responding to any pain stimulus. Just checking patient's airway for any obstructions. Airway is clear. Just going to check the patient's breathing for 10 seconds. See if his chest rises. Chest isn't rising. Patient is in cardiac arrest. We'll put a towel underneath his neck to open up the airway. Can you start compressions, please? Going to attach the defib pads to the patient, working around Louisa. Go. Turning on the defib.
Analyzing heart rhythm. Do not touch the patient.
Away from the patient, please. Calling for backup. Calling comms R50 to the scene,
clear
please.
of patient.
Staying clear.
Deliver shock now. Press the orange bar shock.
Delivering shock.
Pause. Start CPR.
Please start CPR, please. We will be putting an OPA into the patient's mouth to open up the airway. To measure an OPA, we need to go from the corner of the mouth to the corner of the mandible, inserting it backwards and rotating 180 degrees. Indications is GCS below 8 and incomprehensive sounds to pain. Contraindications is intact gag reflex, complications, wrong size, induced vomiting, soft tissue damage, and trismus. Also, if the OPA doesn't work, you can insert an NPA. To measure an NPA, you go from the corner of the nose to the corner of the mandible, inserting it downwards into the face. Indications is GCS below 8, incomprehensive sounds to pain. Contraindications is TBI, extreme facial trauma, complications, bleeding, and polyps. We will then be getting the BBM ready. Bag valve mask. Attaching the mask to the bag. And attaching it to the patient. We'll be using a C-grip onto the patient to avoid any leakage. When using the bag, we push only a third of the bag to avoid gastric inflation. So you can count from 25, please.
25, 26, 27, 28, 29, 30.
1, 2. Start compressions again, please. We will then shoot. Louisa will be carrying on with compressions.
26, 27, 28, 29,
Analyzing heart
30.
rhythm. Do not touch the patient.
Hands off patient, please.
Shock advised.
So we'll switch places. I will do compressions.
Stay clear of patient.
Stand clear.
Deliver shock.
Delivering shock.
Press the orange button. Shock delivered.
Shock delivered.
Pause. Start CPR.
Does anyone know this man? He's your friend? Do you know what happened?
9, 10, 11, 12,
How long has he been like this?
16, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30.
Is he allergic to anything that you know of? How well do you know him?
1, 2, 3, 4, 5, 6, 7, 8,
Do you know if this has happened before?
13, 14, 15,
It has? How often does it happen?
20, 21, 22,